Okay, welcome to this talk on March 24th, 2026 for the Weathering Change Seminar Series. Our today's speaker is Dr. Ray Yeager from the University of Louisville, and I will turn it over to him to get into his talk since he's told me he's got lots of slides to get through.
All right. Well, thanks so much, Kermit, and for maximizing the time that I have left for the presentation. And with that, I will share my slides. Just let me know if you're having any audio-visual issues. So yeah, thank you all so much for the invitation to talk today. Kermit and I were just briefly chatting about, how nice it is to hear about the work coming out of all the various climate and health centers that are around and all the work that needs to be done. So I'm Ray Yeager. I'm an assistant professor at the University of Louisville School of Medicine in our Division of Environmental Medicine. My background is actually more in health geography. It spans across areas of public health and environmental sciences, epidemiology, you name it, because to do this kind of research, as you all probably well know, that you have to have a pretty broad interdisciplinary background. Most of my past research centers around green spaces in health, kind of independent of climate change, to be honest, which is where a lot of this sort of adaptation component comes into play. So the outline today for my talk is fairly simple. It centers on impacts and adaptation. Basically, that can be reframed to, what is the problem and what can we do about it? So as a lot of the folks on this call likely know, climate change affects human health in many, many different ways. I'm not going to walk through each of these, but suffice to say, each of these categories have many, many subcategories in them. Here, the Cincinnati Center is very focused on extreme heat, so I'll try to mention that a little bit more, but of course it is central to the impacts of climate change on human health. So suffice to say, with all of these categories, everything that lies within and the ways that they interact together, that climate change is affecting pretty much nearly every, in one way or another, in nearly every environmental determinant of health, nearly every social determinant of health, nearly every behavioral determinant of health, and nearly every mental determinant of health. And a lot of times these are very complex, they're place dependent, and they're change dependent as well. So when we talk about cumulative impacts, how do we actually address, what is the totality of impacts of climate change on human health? Most of the work out there being done centers on, one of these factors and an outcome, or one of these factors and a mediator. So how do we put it all together? And this sort of summative putting it all together is really important to drive how we understand the extent of the problem, because that just hasn't been quantified to drive climate negotiations and to drive investment to adaptation. So here's a different way to look at that diagram. And what I want to note here is that most of the research currently going on with climate change and impacts on human health is sort of very, very short-term exposure outcome focus. That's sort of our, if we have any environmental EPIs on the call, right? That's our bread and butter, is an exposure and an outcome. If you look across most of the literature on extreme heat, a lot of that is based on heat waves and hospital admissions. There's a lot of newer research on non-optimal temperatures. That's pretty startling, to be honest. But when it comes to the totality of impacts of climate change on health, a lot of these pathways operate through non-acute, non-exposure effects on health and long-term effects on systems and population health. So how do we address that when really there's not that much evidence out there, because, well, it's really complex research to do? So one of the ways we can do that is take, these various ways of measuring climate change and do climate attribution research. Basically, how much more likely is a certain event due to climate change how much worse is a certain event most likely due to climate change. So Climate Central is doing a lot of really excellent work on that and doing rapid attribution research, as you can see here on the right, from the current heat dome that is covering the United States. So what you're seeing here is basically shifted to the east over the past week. I'm guessing a lot of you are feeling it or have felt it. So doing that attribution research, figuring out how much of an insult is due to climate change. And then once you do that, you can basically figure out what the health impact of that insult is. And by linking those two things, understand the health impact of climate change. But that's still generally, one insult at a time. How likely is this extreme event? You're still limited by, acute exposure, acute outcome. So another way to kind of get to those cumulative impacts is basically looking at place-based associations between the extent of climate change and health. So when you do that, it suffers from several limitations. One being, which is somewhat of a limitation, somewhat of a strength, is that you can kind of wipe out all of those intermediary pathways and just stop thinking about them for a minute because they are enormously complex. You have people just straight up tell me, oh, this is impossible to do, to put together all of those insults to get cumulative impacts on health. But what we can do is look at the extent of climate change associated with the extent of health outcomes that's kind of mediator, moderator, agnostic. So when you look into existing literature on that topic, there's very, very, very little out there. There's really, only a handful of studies. So one out of Europe basically demonstrated that the impacts of heat waves are worse in places that have experienced a greater extent of climate change, independent of the actual place-based extent of that heat wave. So basically, a heat wave to, let's say, 38 degrees Celsius is going to have a different impact in a place that just isn't ready for it. Similar things have been observed in New England, where a 1 degree rise in summer temperatures are associated with 1% higher mortality. In winter, a 1 degree rise in temperatures is associated with 0.6% less overall mortality. And then a more recent paper used a pooled nationwide cohorts, a nurses' health study, and some other associated cohorts with that, and had similar findings. But that sort of, it again, starts to tell you that the extent of change matters, which isn't really that much of a surprise, but the surprise is how little research out there that there is to demonstrate that, and how little that's been pursued to sort of understand what the total impact of climate change is. So upon kind of realizing that literature gap, myself and some colleagues started in on this paper. It was just accepted at the journal GeoHealth, so hopefully you will see it up online quite soon. Check back in a couple weeks and it should be there. And with this, we very deliberately looked at the association between the extent of climate change, the place-based extent of climate change, and cardiovascular disease prevalence in the United States. So before I even get into it, I will say it is an ecological analysis. There's many limitations, but I think of it as a first step in this line of research that I think could be quite important. So first of all, how do you quantify climate change? Well, there's a lot of data sets out there. We went with this ERA5 climate reanalysis data set out of the European Union Copernicus program. This can be summarized into basically using reanalysis methods to quantify weather patterns on an hourly basis at a global scale, going back in some cases to the 50s or before, with many, many different measurements of climate. So I'm not going to go into the details of that, but if you're interested, follow this link. There's an excellent, very digestible explanation video of how those are compiled. Highly recommend that. So taking that ERA5 data set, we linked these climate reanalyses data going back through 1970 to U.S. climatological divisions, which are relatively stable, climate similar divisions in the United States. The benefit of this is that you can kind of wash out the effect of a lot of urban scale climate change with these more regional scale divisions. Because if you just look at urban area, a lot of the change that you observe is going to be due to land cover change. And land cover change is not macro scale climate change, even though it does affect local scale climate. So basically blending all of this together to look at the extent of long-term climate change across the United States at the spatial unit of these climatological divisions. And when we do that, that series of maps on the left is what you get. These are climate anomalies. If you look at that 80 to 89 map, that is the difference between the mean heat index at these climate divisions for the decade 1980 through 1989 compared with 1970 through 1979. So it's basically how much climate has changed in that decade. If you look at the next map, it's how much the climate has changed in 2 decades, the next map, so on and so forth. So that is the extent of heat anomaly change in the continental United States, often referred to as climate anomalies. So when we're talking about the extent of climate change and health, there is an important elephant in the room that nearly all of the research to date, there are some exceptions, looks at one element of climate or exposure or change at a time. So for example, extreme heat. And extreme heat probably is the big one, but extreme rain, drought, flooding, even wind patterns can, ameliorate extreme heat or worsen them depending on what's going on. If you've been out on a hot day and feel a strong breeze, it helps a lot. So the elephant in the room is we're describing climate change one metric at a time. And we really wanted to address that elephant by collecting a lot of different metrics of climate change. So from that ERA 5 data set, we started by collecting temperature and dew point on an hourly basis. Long story short, you don't want to calculate heat index on a daily basis. I'll let you Google that. I don't have time to explain it. But then aggregated that up to monthly and then yearly scales so that we can look at heat index change over time. Then we also aggregated humidity, wind, sunlight, pressure, precipitation, and others. And as you can see by these simple associations, that they are certainly not the same. They go in all different directions to all different extents. So in places where you see heat index going up, well, not surprisingly, you also see air temperature going up. But where air temperature is going up, well, you usually get humidity going down. You get wind going up, oftentimes coming from the west, but coming from the south, it goes down. You see changes in sunlight, you see changes in precipitation that all co-vary with heat index and air temperature change. So the long story short here is when you see these large spatial scale analyses of patterns in temperature, or patterns in anything else for that matter, and health outcomes, it's really important to remember that it's not just the association between that pattern and that outcome, right? When you see a change in heat index, that carries with it changes in every other climate variable. And in the current literature, that's not really addressed so well. So when you map that out, they all have very different spatial patterns too, as you may have guessed. The places where precipitation and humidity are going up largely co-vary. Where you have temperature going up, you largely have humidity going down. You have surface pressure kind of off doing its own thing that somewhat co-varies with sunlight. And then even when you dig down into a single metric, so this is all heat index, the spatial patterns of extreme heat in the form of heat waves and extreme heat days, vary a lot different than changes in the patterns, for the summer. Changes in patterns over the summer are a lot different than changes in patterns in the winter. Changes and variability are a lot different. So all that to say, it's an incredibly complex picture that can't be simply summarized by, annual change or even, heat waves in one single metric, because that always comes with other things and there's always other things affecting the outcome. So to address that, one of the first things we did was just figure out what these patterns are. So with a pretty simple PCA analysis, we threw all of these changes at the climate division level into a PCA, and immediately component one that explains 63% of the overall variation, you can see that no one factor is driving the overall change. So that's an important factor right there, right? Again, where you have temperature going up, humidity's going down, northward winds going down, sunlight's going up. And when you map them out, here's what we have. So this PC1, you can see, is characterized, simply speaking, by increased dry heat affecting the western United States and the far northeast more than other places. Other places, PC2 is characterized by higher surface pressure and sunlight. PC3, 8% of the variation, more stagnant air. 4, 6% of the variation, heat and northward wind. So again, just to demonstrate, the patterns of these changes are much different, and it's a much more complex story than just heat. So the question is, what do we do about it? How do we evaluate associations between climate change and health? So again, in an ecological study, yes, it carries a lot of limitations that I'm trying to address right now, but in the just or about to be, I guess, published and put online manuscript, we use the CDC Places data set, and we use mixed effect models to evaluate the extent of associations between the extent of climate change and cardiovascular disease prevalence in the United States. So for that, there's a lot of things that covary with CVD prevalence. We had two main outcomes, coronary heart disease and stroke, and we used models adjusted for obesity, prevalence of checkups, smoking, impervious surfaces, land cover, more recent temperatures, versus the extent of change in temperature, socioeconomic variability, and proportion of people over 65. And also some mixed effects terms in there. They were surprisingly robust to sensitivity analyses. You can check out the over 20 figure supplemental information when the paper comes out. And what we found was in single anomaly models, so that is one at a time in these adjusted models, looking at associations between heat index and or any of the anomalies and outcomes, the effects, not really too surprisingly, were loaded on the heat index. So big association between the extent of increase in heat index over time across the United States and cardiovascular disease prevalence. Not surprisingly, effect size of temperature was a little bit less than that. And we had some interesting things going on with thermal radiation, wind, surface pressure, but really the overall effect was being driven by heat index. But these are one at a time. So later on, we threw them into one model, but before doing that, we dug down into heat index. And so mean annual heat index was kind of surprisingly, up there as a major driver. Nighttime, not quite as much. Daytime, mean annual heat index change, slightly larger effect sizes than overall annual. Summer change, not surprisingly, large effects there. And then when you get down into winter, that's a little bit surprisingly maybe to some folks, but if you've seen that dose response curve of mortality associated with cold and heat, not surprisingly that increasing winter temperatures are lowering cardiovascular or, associated with lower cardiovascular disease in the US, but that beneficial association is still being overwhelmed by the harmful association with heat. So, interestingly, when you look at extreme heat down towards the bottom of this, so total hours over 41, over 36, over 32, total days over this number, and then also heat waves. The effect sizes actually weren't as big as with annual change, which does kind of correspond with a lot of recent literature coming out on the effects of non-optimal temperatures and outcomes. So when you put them all into one model, kicking out the ones that are highly collinear, this is what you get. So it's very difficult to sort of say because these all happen in unison, right? When one changes, the rest change. So if we see an effect size with heat anomaly change, well, we can't really say for sure whether that effect size, is, all loaded onto basically the right change that we're observing. So what we did is basically just take the sum of the effect size of each of the changes that had been multiplied by the extent of change. So, for example, here we observed that heat index had changed, by a mean of 1.12 degrees Celsius. The effect size was 1.46. We multiplied the two, and then we basically divided that by the existing prevalence of cardiovascular disease in the United States to get relative prevalence. So at the bottom, when you take the sum, you get a 9.8% increase in relative prevalence of cardiovascular disease associated with climate change increase in the United States. Stroke is 28%, which is huge. And yeah, I've had a lot of people take a double take. And that's, again, ecological study. We need better methods that are in progress to evaluate this. But to date, this is the best estimate that we have of the association between the extent of climate change and cardiovascular disease. And I will note this isn't a 9.8% increase in prevalence, it's a 9.8% increase in relative prevalence. So if prevalence is currently 10%, then 9.8% increase would bring you to what? 11% basically. So moving on a little bit. So that's one of the ways that I'm trying to evaluate the cumulative impacts of climate change on human health. And, that kind of approach can't really, at least yet, get to what's actually driving those effect sizes. But suffice to say, we have a pretty good understanding that the net effect of climate change on health is not good. And we also have a good understanding that at this point, you're not, for global climate change, there's no mitigating our way out of it. It's just a matter of how bad it's going to be when it comes to mitigation. And that sort of begs the question of, well, what do we do about it? And this is kind of more into my bread and butter lines of research, but nature-based adaptation. So when I say nature-based adaptation, I'll be focusing mostly on green spaces, which can mean a lot of things from the natural, social, and personal environments. In a lot of cases, green space interventions take the form of planting trees or reducing impervious surfaces to install a park, increasing, services of those parks to nearby residences. And if you're, if you're wondering more at a macro scale on how green spaces and nature are affecting health and what's really driving those, I encourage you to check out this preprint. That's a collaboration between Matt Browning and myself. Suffice to say, the literature on associations between green spaces and health is substantially limited by how we define green spaces. So if that's of any interest to you, highly recommend looking up that preprint. So why do green spaces matter? Well, when it comes to overall health, green spaces are known to promote mental health, social cohesion, physical activity, and environmental quality. So if you remember, with that diagram of climate change and health, Well, all of these sound really familiar, right? Social domains, environmental domains, mental domains, behavioral domains. So green spaces promote health through all of those domains, independent of any climate change resilience, but they also impart resilience through those pathways. But there's a lot of limitations to the current research of green spaces and health that can be summarized in these categories of highly mixed results of current studies, intangible green space measures that can't be put into policy and practice, low representative capacity of a lot of the work that's out there, very little causative evidence, and little implementation research on how we actually put what evidence we have into practice. So, with the second half of the presentation, I'm going to go through each of those in one way or another. So, here's one study just basically demonstrating that there isn't a consistent association between green spaces and health in studies that are subject to all of the existing limitations. A lot of them depend on how we define spatial areas in which to assess green spaces, how we assess the green spaces themselves, how we deal with bias, how we look at comparisons across contexts. There's a lot of nuance involved. I've published several papers that digs into various aspects of these nuances. This is just one of them, showing associations between residential greenness and VOC exposure depend on the distance that you measure the green spaces. It depends on the specific VOCs. It depends on the time of year. And that's just, one of many pathways through which green spaces can affect health. Another major limitation to the field is causative evidence. There's very, very little causative evidence out there because, well, staging experiments with green spaces is very, very costly and logistically challenging, much less evaluating the health outcomes involved. So one of the key studies in the field was out of Philadelphia, where in Philadelphia there was a randomized vacant lot cleanup. So they didn't dig deep into health outcomes, but what they did was evaluate more social determinants. And with vacant lot cleanups, randomized vacant lot cleanups in Philadelphia, they cleaned up the vacant lots, but didn't necessarily increase the amount of green space all that much. Uh, the the investigators observed really enormous effect sizes in mental health and perceptions of crime, in actual crime. And it's not really a stretch of the imagination to think that these enormous effect sizes with social determinants and mental determinants are going to have downstream positive influences on health status. So when it comes to causation, that brings us to one of the major studies that we're working on here in Louisville, which is called the Green Heart Project. It's a prospective and experimental cohort study to evaluate the health impacts of neighborhood scale greening. So it's really a first of its kind prospective study to enroll a longitudinal cohort to stage a neighborhood scale greening intervention and then to evaluate the health outcomes of that intervention. So here's the original timeline of the study with baseline enrollment of the study occurring in 2018 and 2019 with our intervention in 2020. As you might imagine, we were a little bit interrupted in the year 2020, as you may have been as well, by the COVID pandemic. So we had to alter that timeline a little bit. So thanks to generous funding from the Nature Conservancy, we staged a roughly $8 million greening intervention in a study area of Louisville, Kentucky that consists of about 30,000 residents. And then with funding from NIH, we enrolled the cohort baseline and we followed up and got renewed for funding to continue the study through 2028. So with baseline enrollment, we collected a lot of different biomarkers. I can't go into the details of the study and the time I have, but suffice to say, because the associations between green spaces and health are so complex, we wanted to make sure we had our bases covered. The main hypothesis of the study was that this intervention would improve cardiovascular health due to decreases in air pollution. So we are focused on biomarkers and questionnaires regarding cardiovascular outcomes and pollution exposures. But one of the main things that we collected was the address of study participants. And with that address, those geographers in the call might know how fun it is to geocode some of those. But with that address, we can link that to extensive pollution monitoring that's going on as part of the study, extensive heat monitoring, and biodiversity monitoring, built environment assessment, and of course, green space change assessment. So, um, suffice to say for this audience that the primary measure of green spaces in the current literature is NDVI, the Normalized Difference Vegetation Index, based on satellite spectral data. This is a really, really terrible measure, but it's kind of, I don't know, it's used a lot because it's easily accessible and it's kind of consistent. It's available for a large spatial range at high spatiotemporal resolution, but there's a lot of issues involved. So one of the things we're doing with this study is trying to advance beyond NDVI. One of the major limitations of NDVI is that it can't really be put into practice. It's just a measure of overall green cover. So if we find an association between overall health and NDVI, well, okay, so we increase green cover. I mean, you could do that by planting grass or taking better care of trees, planting trees, tearing up concrete, you name it. But we wanted to get more nuance in that. So one of the main things that we're looking at to measure green space is called leaf area index. So basically an index to estimate the leaf area of trees and the study area. Basically to kind of make that connection between, what is green spaces overall, what is being driven by trees to influence health. And it's also just a better metric to actually evaluate the canopy benefits to things like heat, air pollution, noise, soil, biodiversity, and mental health. And again, all of these effects are independent of climate change, but they're all also pathways through which climate change affects health and through which green spaces can ameliorate those potential impacts on health. So we based this LAI measurement from a LiDAR data collection, basically to generate a 3D image of canopy in the study area. And now we can measure change in that canopy over time and basically the extent to which our planting and the extent to which it grows is affecting health and lowering environmental burdens. And we, whether that's heat, air pollution, you name it. So one of the main things we focused on was ameliorating impacts of burdening sources. So one of the main burdening sources in cities is, of course, major roadways. So we planted green space buffers to basically evaluate how much we can use these green space interventions to reduce noise, heat, air pollution, aesthetic blight, you name it, that is being generated by these major roadways. So here's what one of those buffers looks like in practice. This is a photo of one of the buffers that was planted as part of the intervention. We also planted schools, private residences, parks throughout the project area. So here's sort of zooming in some of the places we planted trees, all of those points being a different genus of tree. But what you're seeing with the background image here is change in NDVI over time. And just to demonstrate how bad NDVI is, you can see when I kind of toggle back and forth between those trees and NDVI change, orange is reduced NDVI, green is increased NDVI where we planted trees. We actually lowered NDVI. And a lot of people have to do a double take of that. Why is that? Well, it's because NDVI is so bad. It's based on spectral signatures. So when you plant trees, NDVI goes down because to properly take care of those trees, you need mulch. And you tear up grass to plant the trees. So highly recommend to anyone listening in on this call, if you're thinking about doing a health impact assessment of tree planting based on NDVI, don't, because you will find that planting trees kills people with the traditional health impact assessment methodologies, and that is not the case. It's just that NDVI is really bad. So here is LA overlaid with that. So now you can see actually where we planted trees, leaf area index is going up. You can see where existing trees are dying, where other trees are growing, and we can get a much, much more precise measurement of that intervention, its effects on environmental quality, and its effects on health. So I'm not going to go deep into some of the results that we found so far, but I will just briefly touch on those metrics in this cross-sectional paper at Baseline that we published. So here are basically maps of the distribution of NDVI, LAI, and grass in the study area. You can see NDVI doesn't differentiate between where you find leaf area and where you find grass. And we looked at associations with blood pressure. Long story short, we found no association with NDVI, which is the most common measure. So we would have been one of those studies that has null finding in the field, which are many. But when we look specifically at leaf area index, yes, there are associations between green spaces and blood pressure in the expected effect direction. Surprisingly, we found backyard grass was associated with higher blood pressure. Can't fully explain that one, but just to say, you get some surprises when you really start doing better green space exposure studies. But when you dig down in stratified analyses, we found that those associations were loaded on to female participants, to those who exercise less, and not as surprisingly to high traffic areas, because basically it's in those high traffic areas that measurements of dense vegetation better capture the environmental benefits of that vegetation to reduce air pollution, noise, heat, so on and so forth, in the areas that have more of those things to reduce. And that brings us to place-based context. So if you're going to do a tree planting intervention, I think it's probably not hard to imagine the optimal intervention is going to look a lot different in the image in the right versus what it would look like in the image on the left. The entire body of literature, for the most part, that's a generalization, suffers from this limitation, right? When you compare findings, let's say, from a study conducted in the neighbor on the right versus the left, they might be a little bit different for many different reasons. Another example, so here's one lovely walkable corridor where green spaces are improving health through shade, through air pollution benefits, through mental health benefits, enabling healthy activities. And if you go one block over from where this photo was taken, you find this scene where you have the exact same canopy characteristics, but that canopy is trapping vehicle emissions and it's not providing benefits to people using space. So again, the exact same canopy, even one block away, is providing a very different profile of benefits and sometimes harms to population health. If you zoom out a little bit, you have very different burdens. So in some cases, green spaces may ameliorate air, noise, and heat pollution. In other spaces, maybe there's not as much of that pollution, but you can use green spaces to bolster physical activity. And other places, sensitive populations might have unique needs and considerations. And for each of those spaces, the type of green spaces that you are planting are going to have different effects. Same goes for the effects of climate change on these different spaces. So the state of the literature right now is really kind of wishy-washy because it's so reliant on these limited metrics, and we don't really have a lot of specific evidence to say, like, okay, we really should do these types of interventions in these types of places. But what we can say is if you're in a high burden area, you really want to focus on density, on biomass, on canopy volume that's going to lessen those burdens. If you're in a dense, low burden area, really focus on quality of life things that are going to, reduce heat exposure, increase park access, increase healthy behaviors. Rural areas, there's evidence isn't so great, but it seems like just general canopy cover, promotion of biodiversity, and especially physical activity are the way to go. And each of these, there's really unique place-based climate change considerations to the burdens of what kinds of climate change are happening in those places. So the next question becomes, well, how do you actually implement that? So we can get a little bit more detailed with talking about characteristics of green spaces to reduce burdens that a specific place experiences, whether that's overall or whether that's due to climate change. And yeah, so really with that, there's a lot of limitations, but there's ways to overcome that. And this, for us is sort of a diagram of what it boils down to, doing a baseline assessment, figuring out what the needs are, what plannable spaces or potentially plannable spaces you have to work with, prioritizing areas to go, using community feedback, and selecting the right species with the ideal designs to best benefit health based on the needs and the potential of a specific place. But of course, all of those specific places are going to have their own profile of climate change challenges to deal with. So the future risk needs to be considered as well. What are the future health challenges? What are the future species that are going to survive in that place? Because if you just plant a bunch of trees that are going to be basically killed because it's getting too hot, which is already happening in a lot of cities, that's obviously not the way to go. So here's one example of what we did in Greenheart to kind of put that into practice and looking at the place-based burdens and the place-based opportunities to best ameliorate those burdens. But of course, those burdens and what you do about them are going to vary drastically from place to place. So I'm going to take a quick pause and go ahead and go through the acknowledgements before I finish up. Especially for Greenheart, it's been a massive undertaking that has involved thousands of people from the community members, study participants, volunteers, various collaborators, students, funders, contractors, and others. So here's the team of investigators led by Rooney Bhatnagar, the principal investigator and co-investigators, many other contributors, and then other collaborators to some of the climate and health work and other results that I just ran through very quickly. And I always like to end on a somewhat optimistic note because this climate and change health topic is rather bleak. So what you're seeing here is the difference in leaf area index change from where we planted the first tree in Greenheart to 4 years later. So even just looking at this, maybe not to you, to me, this is rather dramatic because we planted that tree and then over the course of 4 years, the leaf area index of that tree went up by a factor of about 10, which is really impressive. You may as well just have the benefits of planting 10 trees right there, right? Because you're getting a lot more leaf area as it grows. But here's what that tree looks like in real life. We had a nice little ceremony for the first tree as part of the project. It was in a schoolyard. The kids in that school came out and sang a little song about trees. And they actually named the tree, by the way. They named it Unique. So I like to check back in on Unique every once in a while. So checking in on Google Street View a few years later, here is what Unique looks like. I love this image because you can see the worn ground below Unique. Those kids are using the tree, they're getting the shade benefits, they're getting play benefits, they're getting social benefits, they're getting mental health benefits. And I think it's a really excellent representation that addressing the challenges of climate change don't have to be this massive, unobtainable undertaking. Just planting one tree the right way in the right place can make a meaningful difference. And the more you scale it up, the better. The more evidence you have to do that, the better. So checking on Unique, 5 years after it was planted, those same children held a birthday party for Unique. As you can see, it's already grown quite a lot from that street view image. So have the children. And in the next generation of children coming through the school, here 7 years later, And now you can see most of the class resting, playing, and getting the benefits of that one tree that's planted. And it's just a very, I think, tangible example of these, sometimes city, neighborhood, global scale issues that we're talking about. But this is just one tree making a big difference. But when we do zoom out to those global scales, let's be honest, the picture is bleak. Emissions have happened. Even if we stop all emissions today, climate change will continue for decades, if we're lucky. But I don't think we're going to stop all emissions today, and these health impacts are going to get worse and worse and worse. So we have to really, have some frank discussions as a research community and what our role is to do something about this. And the research that we do to understand the health impacts, whether they be specific or cumulative, of climate change specifically, and really start hanging some numbers on that can really affect the outlook that we have. And it's going to be more important for the outlook of our children and our grandchildren because they're the ones that are really going to be living with all of the impacts. And, our ability to make a difference in this stems to me on two things. One is understanding the cumulative impact and starting to hang some population numbers on that. Because when we know the cumulative impact, we can start to quantify that impact in human terms and financial terms. And, if you're looking at, let's just say, a 10% difference in cardiovascular disease that's attributable to climate change, well, you look at the amount of money this country spends every year on cardiovascular disease, healthcare costs, and lost productivity. When you're talking about the long-term impacts of climate change, you are very, very quickly into the trillions and trillions of dollars, which is enough to really raise some eyebrows for mitigation conversations. But that needs to be done first. It needs to be rigorously attributed. And like I said, climate change is locked in. And even if we stop all emissions today, there's still going to be worsening impacts. There's going to be more visible impacts, which means there's going to be more willpower to actually do something about those impacts, which is where adaptation comes in. And one of the easy solutions is just dump a bunch of money into planting trees. But before that happens, I mean, that can happen now, right? But we really need to do the research to understand right tree, right place to best adapt to climate change and best reap the co-benefits of health. Because it's likely that for adaptation, at least, the co-benefits of adaptation, especially through nature-based adaptation, can be much larger than the benefits from mitigating climate burdens alone. It's really important for both. But basically, that is to say, once investments into adaptation start really taking off because increasingly more severe impacts, there is the potential that with the right evidence, we can get a really massive public health co-benefit from massive investments into adaptation efforts. So, I don't want to be a downer here, but at the same time, we really kind of need to look forward into this reality that mitigation is incredibly important because even though climate change is going to continue happening one way or another, how bad it is the question. And it can be many times worse depending on mitigation decisions that are made now. And what we do about it, if we get the right research, can have many times better co-benefits. And that's what I'm trying to sort of center these research priorities around. And with that, I know I ran through that very quickly. I'm happy to take any questions. And for the more complex ones, perhaps a following conversation would be better.
Thank you. That was very impressive. I think we saw some of the parallels of things that we've been talking about for the last several months with overall things, but some of the context that we didn't even consider, I think, on of it. And I really appreciate your talk. Does anyone have any questions? If so, just pop on and put your video on and ask them a question. Anyone? If not, I will.
But, oh, no, no, yeah, just give us a moment. I was just chomping on a bit of lunch here. Ray, that was wonderful.
Thank you.
Really great. And I think it's relevant for so many communities. We're not very far from Louisville, obviously, or where Greenheart was done. There are significant differences between the cities, though,
Yeah.
and the kinds of things going on. I just want to make an observation and get your feedback on things. You hit so many important themes, including the right tree, the right place. Why we want to do this, deepening the evidence for both mitigation and adaptation. That hopefully that deeper evidence helps mitigation, but God knows how that's going to work. But it was still maybe so, and hope so. But here in the city, we've had organizations, and I don't know if you've worked with some of these more like Groundwork ORV, the Ohio River Valley. They are a national nonprofit, but they have been working and planting trees in what we call heat island communities. There is no specific evaluation of their efforts. There's also in various places. I saw that Nature Conservancy and a whole bunch of other organizations were a part of this effort there.
And real quick, one thing I forgot to mention was under the last administration, $1.5 billion went to urban forestry interventions in burdened communities. So it's happening all over the country in a big way.
Yeah. So I think maybe happening all over the country in many different kinds of strategies. And also it kind of gets to your question of being much more nuanced about what we're trying to do and how that nuance works in different places. But I guess we have a new collaboration here with our P20 Center, potentially with Cardinal Conservancy, which is another one of the kind of organizations here. It's a big one for us. And trying to figure out, the best way to partner, best kind of questions. We're starting to feel our way towards that, but how to be complementary with anything we do here, but also complementary to what has already is being done elsewhere. So I guess, asking you to muse a little bit on, because I've seen this as part of the P20 centers kind of beginning to say, well, how do we work together across different places?
Mm-hmm.
To actually do more targeted and more impactful, optimize our impact. And, some people would argue, well, we're already green in Cincinnati. It's like, we've got so many trees here, but not always, as you say, in the right place and the right type, or, what are we trying to accomplish? And I guess we're feeling our way towards action here. And trying to move that more quickly. So, your talk is very timely, but I guess the thought of collaboration, I guess that's where my question lies. How might different centers who are interested in nature-based solutions, but who are in somewhat different, we're all in different environments after.
Yeah. Yeah, certainly. And certainly, and for good reason. That's exactly what NIH is looking to, for these centers to collaborate. So there is the what do you call it, the coordinating center, the Harvard Bee Coordinating Center. So through the coordinating center and related efforts, there are a lot of data harmonization efforts. There's a lot of efforts to empower all of these centers with tools. But I think some of that requires conversations just like this, right? So if you all are interested in certain things and evaluating outcomes, it becomes a question that's sort of, more traditional cohort-based epidemiological approaches of how do we look at what the weaknesses of any one study is and address those by collaborating. So, right off the bat, harmonizing any human data collection analyses, harmonizing environmental collection, even if it's for only some variables, allows pooled analyses. Because like you said, Louisville and Cincinnati aren't that far away. We're not that dissimilar, but in some ways we really are. So
Right.
we might not know, planting a certain type of tree in a similar neighborhood in Louisville and Cincinnati, how is that effect going to differ? Is it going to differ? Are the hills in Cincinnati going to play a different role in the pollutants? Is, some nuanced cultural consideration in Cincinnati, or, patterns of housing change, that sort of thing, going to change the effect of that tree? Is a place that's potentially subject to much more green gentrification going to be affected differently by that tree? So on and so forth, right? And I think, because Green Heart, we're just one neighborhood in one city in the United States, and there's only so much we can generalize those findings. I think some findings can be generalized more than others. But more importantly is, how do we optimize? How do we go to a place where, we don't have the research, because this lines of research take many years to develop, and say, okay, based on existing evidence, we know from Cincinnati, we know from Louisville, we know from LA, we know from Miami, and you have these characteristics, and these things are going well in these similar places with these similar attributes.
Right.
You
I
can
think
only
that
do that with collaboration and harmonized data.
we're all for collaboration here, and would love to come down and to Louisville and just chat. So,
Yeah, fantastic.
okay.
Or even give a talk down there of ours. Reciprocate.
Yeah.
Anybody else have a
Yeah,
question?
yeah.
So I have one question on your picture of the child's area with the one tree. Since you've seen such a growth, why have you not gone back and planted a second tree or a third tree, like very similar? Because there was a lot of area in that area that that was not shaded, that I think could easily have come into to play, I guess.
Yeah. Well, the simple answer to that question, short answer at least, is it was just a point in time intervention. There have been some more plantings, not a whole lot of others, but just so we can follow it without continued intervention. Now, in that school, they have chosen to plant some more trees. Maintenance is a concern in that school and with our project and many others. But yeah, suffice to say, we would have liked to have planted many more. But I think that was just kind of dependent on the community conversations that were happening at the time. And maybe the school was just a little uncomfortable with us planting a bunch of trees and sort of wanted to focus on one. I don't know. I'll have to get kind of the backstory on why we originally only planted one, though.
Oh, I was just thinking not a bunch of them, but there was sort of like 3 other corners that could have been easily taken up. That would have been a nice one.
But yeah, now 8 years later, I mean, if we planted 20 trees, we could now have shade in the majority of that schoolyard.
Right. Alaska.
Yeah, hello. Thanks very much for your presentation, Ray. Much appreciated. Oh, yeah. My question is more of a comment too about linking up with community groups. I had to miss the first part of your talk, and you probably are focused on community outreach. But as I've been working with community groups across the city, I'm amazed at how aware they are of the impact of climate change. Remember, 80% of the Americans support climate change amelioration. Minority don't. And in people who are civically active, those groups are extremely interested in trying to ameliorate climate change in their neighborhoods, because they feel it every day. And putting trees in parks and green spaces is a wonderful way of doing it. So thank you for putting that idea in, but the collaboration with community groups is important.
Yeah, absolutely. So for Green Heart, I want to emphasize the point of Green Heart was a scientific study, and like the community planting was sort of like a way to do that, but we did have substantial community engagement. And just like planting trees is nuanced, community concerns are even more so. Our community, increasing canopy was a priority that was outlined in several neighborhood plans that the study was in or adjacent to. But when you went out to individuals, a lot of them said, why are you spending all this money planting trees when we have, crime problems, drug problems, car crashes, infrastructure issues, X, Y, and Z. And, that's a tough conversation to have. Um, and, really varies a lot from person to person versus sort of this nebulous idea of community too, of course. But suffice to say, we integrated as much community feedback as we could and what we planted, where, and also just informing the community what we're doing and why.
Marley Jacola.
I have like a very specific question, so I'm sorry if it's too specific. But I like just looking into like the tree canopy coverage for the Alberta O. Jones Park that's in Louisville. But a LiDAR test is like what I've been looking at. So is because it was a LiDAR, is that like is leaf area index what that is then looking at for that park, or would that so like it wouldn't be in
Yeah.
DVI, or do you know like is it leaf area index?
So leaf area index is a secondary product from LiDAR to basically estimate total leaf area. So from LiDAR, there's many different things you can calculate. So you could basically develop like three-dimensional tree canopy polygons. You could develop polygons for really any structure. And a lot of research just knowing the ground level is important. But yeah, so the thing with LiDAR is it gives you a precise three-dimensional measure of what physical objects are where, right? So that's raw LiDAR data. That's all it is three-dimensional point coordinates, but a lot of them. And from those, the sky's the limit. If you can imagine it, you can calculate it based on LiDAR.
Okay. Thank you. That makes sense.
Good.
Anybody else? If not, thank you, Ray. This has been really great. I really appreciate it.
All right. Thank you all so much.
And I think it does put in some perspectives for us moving forward. So that's been great to hear, and I appreciate your time.
Yeah, thank you all so much for the invitation. Always happy to get the word out on these things.
Yes.
There's not much more important we could be doing. So
yep.
Thanks again and have a great day.
All right. We'll talk to you later. Thank you.